Hello and welcome to the ETS Toolbox Talk on facial coverings for COVID-19. To prevent infection and slow the transmission of COVID-19, it's very important that we all practice the following. Wash your hands regularly with soap and water or clean them with alcohol-based hand rub or sanitizer. That's at least a minimum of 60% alcohol. Maintain at least 6 feet or 2 meters of social distance between you and others. Avoid touching your face. Cover your mouth and nose when coughing or sneezing. And of course, stay home if you feel unwell. And always, when in public settings, wear a facial covering. Spirax Sarco has developed group minimum standards for COVID-19. Facial coverings are required if 2 meters or 6 feet social distancing cannot be achieved. Exceptions may be granted to the general manager, who can authorize a 1.5 meter or 4 foot social distance if local regulations are less than 2 meters. Examples include while at your desk, within the warehouse, or on the shop floor, walking to the kitchen, to the canteen, to the toilet or loo, walking around the warehouse, or any other areas along the shop floor. Facial coverings are not required if social distancing requirements are met. Face masks or facial coverings to be made available to all employees and made readily available at key locations such as entrance and exit points, at the reception areas, and on each floor of buildings. Visitors, contractors, subcontractors whose primary place of work is not within our company must wear face masks and sanitize hands upon arrival. So, how does face masks or facial covering stop the transmissions of COVID-19? Without a mask, droplets produced during coughing can travel up to 12 feet. However, with a mask, this distance is reduced greatly to just a few inches. Provided below are demonstrations of how this is performed. Homemade cloth masks provide greater level of protection for the individual by reducing the transmission of the virus, as well as cone style masks, which can help as well. But you will notice there's more leakage with these cone style masks. Therefore, even use of a homemade cloth mask provides a better level of protection for you. Just remember that all masks are not created equal and do not work in the same way. It's important to choose a mask that fits appropriately for you and that will work effectively based upon current scientific data. So, some examples of facial coverings include the following. In terms of required PPE, you have a surgical mask, which is universal in its design and style and how it is worn. And you also have the cloth fabric face mask or facial covering, which is also universal. It may be homemade or something that you may purchase in a retail establishment. Other optional PPE include an N95 respirator, which is deemed to be a tight fitting respirator. Please note that exhalation valves are not allowed on this style of a respirator. If used, there may be additional training and reporting requirements that may apply, even if you use it voluntarily. Please contact EHS for more information on how to appropriately use this style of respirator. With facial covering standards, they will vary by type of respirator or facial covering used. We're going to take a moment to talk about both loose fitting and tight fitting respirators. So for loose fitting respirators, surgical masks are also made of special material, but they don't provide a seal around the nose and mouth, meaning that smaller droplets may still be inhaled. Surgical masks are good to protect the nose and mouth from larger droplets from coughs or sneezes and for preventing infected people from spreading droplets. Cloth masks are not considered PPE, personal protective equipment, but they are approved for COVID-19 as a means of source control where the risk of transmission cannot be controlled through engineering or administrative controls, including social distancing. Cloth masks do not provide a seal around the nose and mouth, and their effectiveness is unlikely to be improved by face shields. If surgical masks are not available, cloth masks worn by infected people may reduce the spread of large droplets and can be equally effective. Additionally, masks are made to act as a barrier to splashes or aerosols, such as the moisture from a sneeze, and they fit loosely to the face. An approved surgical mask typically has three layers. It has an outer hydrophobic layer, which repels water, blood, and other bodily fluids, has a middle filter layer that is designed to filter bacteria, and an inner hydrophilic layer, which absorbs water, sweat, and spit. Cloth or fabric mask. So a cloth or fabric mask is a non-FDA Food and Drug Administration in the US regulated mask made of common textiles and fabrics. Again, they are not FDA approved, nor are they tested. They are considered as an alternative solution and are not promoted or sold in place of approved and tested medical devices like surgical or respiratory masks. Cloth masks are recommended in epidemic and pandemic situations like COVID 19 to protect others and ourselves from virus laden droplets. This means that cloth masks are supposed to protect us from other people's sneezing, coughing, and airborne particles from entering our airway and mouth. It's also important to protect the eyes as a pathway as well for transmission. Just know that when combined with other safety measures, such as hand washing, social distancing, cloth masks can limit the spread of the virus by helping block large droplets from coughs and sneezes. They are not proven to be effective for healthcare staff and patients, but are recommended to be worn as an alternative to surgical and respiratory face masks. Cloth masks, though not the best possible protection, can still lower the risk of being infected or infecting others. They are mostly recommended as a safety measure for people who may be infected but have no signs of illness. They are not recommended to be used by people who are already sick and show visible signs. They should be worn in public settings where social distancing measures are difficult to maintain, such as in the grocery store, especially in areas of significant community based transmission. There are recommendations from the World Health Organization and the U.S. Centers for Disease Control, the CDC, on how these masks should look and how they should be made. According to the FDA, cloth masks should have three layers: an inner layer that absorbs, a middle layer that acts as a filter, and an outer layer, possibly made from a non absorbent material like polyester. Cloth masks need to be regularly washed and sanitized. It's important, if possible, to do this every day. Provided below is a visual example of how to wear a mask. Step one, hold the mask via the ear loops and ensure that it covers your mouth and nose and place the loops over your ears. Step two, pinch the metal strip or stiff edge of the mask so it takes the shape of your nose bridge. Step three, once the mask is soiled, remove it by holding the ear loops. Step four, dispose soiled mask into the bins, into a trash bin or other designated receptacle. And step five, wash your hands thoroughly with soap and water after disposing the mask. Remember, washing hands for 20 seconds or more makes a difference. Next, we will talk about the facial covering standards for tight fitting respirators. In this example, we will talk about the N95 respirator, which meets the US standard. As you will notice, it has no exhalation valve, as well as the KN95 respirator, which is the China standard. There may be other standards from other countries that also may apply here that meet the definition of a tight fitting respirator. Tight fitting respirators are made of a special material that removes greater than 90% of even the smallest droplets. They are manufactured to fit with a tight seal around the nose and mouth so air and viral particles can't go around or get around the side of the respirator. Approved masks for COVID 19 in summary include the N95, which stops at least 95% of particles of zero point 0.3 microns and meets the US standard. The KN95, which stops at least 95% of particles of zero point 0.3 microns, again, meets the Chinese standard. And then the FFP2, which is the European Union standard, including the UK, and it stops at least 94% of particles of zero point 0.3 microns. Different countries do use different codes and numbers to name their respiratory masks. They are all very similar. The higher the numbering, the higher the filtration protection. For those employees living in the U.S., there may be additional requirements for wearing a respirator. The U.S. Occupational Safety and Health Administration has a respiratory protection standard that must be complied with. If wearing a tight-fitting respirator in the U.S., the following requirements do apply. There are two distinct user types for wearing a respirator. There's the mandatory user and the voluntary user. And it pretty much sounds as it is. The mandatory user means the use of a respirator is required as a condition of employment. A voluntary user means the use of a respirator is not required as a condition of employment. As you can see, as detailed in these examples, very different requirements and somewhat similar requirements for both the mandatory and voluntary user. For instance, the mandatory user has to comply with a written program that details the respiratory protection requirements. They must complete an OSHA Appendix C form. Medical evaluation is required. Training is required. Fit testing is required for all tight-fitting respirators. Facial hair is prohibited. Respirators are properly cleaned. They must be stored and maintained. And the employer is required to pay the costs associated with the respirator use. Under the voluntary user program, again, a written program is required, but a much simpler version of it. The OSHA Appendix C form is still completed. The medical evaluation for specific respirator types may be required, but in this case, dust masks are excluded. Employee is given the OSHA Appendix D in lieu of training. Fit testing is required for specific tight-fitting respirators. Dust masks, again, are excluded. Facial hair is strongly discouraged. Respirators are properly cleaned, stored, and maintained. And as far as employer costs, they're optional, except for medical evaluations and cleaning equipment costs. To further understand the facial hair restrictions for a tight-fitting respirator, it is important that you consult the diagram that's provided below from the Centers for Disease Control and NIOSH on proper facial hair types. This information is also available on the EHS Teams page as well as SharePoint site. In this particular example is the clean shaven user, and you will see other green check marks for other acceptable facial types, such as the soul patch, side whiskers, the pencil mustache, a toothbrush, or lampshade, or Zorro mustache. There's others such as the Zappa, the Walrus, the Painter's Brush, the Chevron, and the Handlebar, which have all been approved and sanctioned for use when wearing a tight-fitting respirator. All other styles of facial hair, including full beard, a stubble, a goatee, and many of the other examples that are provided through this diagram are not allowed. So, how do you wear a disposable respirator that's tight-fitting? Here are just a few pointers on how to properly wear a disposable respirator, including cup the respirator in your hand with the nose piece at your fingertips, allowing for the headbands to hang freely below your hand. Step 2 is position your respirator under your chin with the nose piece up. Pull the top strap over your head until it rests on the crown of your head, above your ears. Pull the bottom strap over your head and place it on the back of your neck so it rests just below your ears. It's important to note, pinching the nose piece using one hand may result in an improper fit and less effective respirator performance. Use two hands and be sure to follow proper user instructions included with your respirator. Using both hands, starting at the top of the nose clip, mold the metal nose clip around your nose to achieve a secure seal. If the respirator mask becomes damaged, dirty, or breathing becomes difficult, it is important to replace it immediately. Again, providing a visual example of how to properly wear a disposable respirator. Step one, wash your hands before putting on the mask. Step two, select a suitable N95, KN95, or equivalent mask that fits well. Step three, hold the mask with a cupped hand and place it firmly over your nose, mouth, and chin. Step four, stretch and position the top band high at the back of your head. Stretch and position the bottom band under the ears. Step five, press the thin metal wire along the upper edge gently against the bridge of your nose so that the mask fits nicely on your face. And step six, perform a fit check by inhaling and exhaling. During exhalation, check for air leakage around the face. So here's some do's and don'ts of wearing a facial covering. Don't leave your nose exposed. Don't leave your chin uncovered. Don't allow gaps on the sides of your mask. Don't cover only part of your nose. Don't lower your mask to rest around your neck. And most importantly, do wear your mask so it is completely covering your mouth, your nose, and your chin, and so it is tight against your face. This is how a mask is properly worn. So, we want to thank you for participating in this training session, and hopefully you learned something new about how to wear a facial covering. If you have any questions or concerns, please feel free to reach out to your EH&S professional. Thank you and have a good day.